you so much for joining Huddle Up Moms for the 2020 Roanoke Pregnancy and Postpartum Resource Summit. We are joined today by Rebecca, who is going to be presenting on mindfulness in birth and beyond. This is an exciting session that we are really excited to have her present to us. We will be taking questions, so please use the Q&A feature in the webinar to submit questions. You can also use the chat box for chatting with one another or sending some less formal questions, and I'll be keeping an eye on both places. Without further ado, please join me in welcoming Rebecca as she presents her session this morning.
Hello and good morning. I just had a little hiccup in my PowerPoint sharing. So let me go back here and see if we can get it back in action. So thank you for your patience as I work on that. All right. Can you see now that the PowerPoint presentation? Oops, let's see. Oh, I was concerned we would have this little, okay, great. So it looks like we're okay. I am just going to try and take a moment and just reorganize for a moment. We had it all set up and then there was just a little hiccup as we transferred over. So I am going to try. Oops. Oh, give me just one moment. I'm going to try it one more time. All right, so we'll start here. So my name is Rebecca White, and I am one of the 3 midwives with Lewis Gale Midwifery, and I'm very excited to be with you all today. We're attending births now in the Lewis Gale Medical Center in Salem, and we also have offices in the Radford, Floyd, and Daleville area. And I've been a midwife in the New River Valley for about 6 years, and I'm excited to be crossing watersheds into the Roanoke River Valley as well now. And I'm very excited and also a little nervous to be here with you today. And I so love talking and thinking and working with the concepts of mindfulness and the mind and the body and relationships with ourselves and each other and a sense of interconnectedness. So, and what an amazing organization that HUM is, this Huddle Up Moms. And they're so good at connecting all of us with that interconnectedness, especially when we may be feeling more isolated now than we ever have before. So thinking also that this was just my first webinar that I am actually hosting on Zoom. I've had a lot of opportunities to participate in them, I'm sure as we all have lately, but this is the first one that I've been sort of hosting, and so there's the inevitable technical challenges that I'm bracing myself for, because we do have some audio components that I want to share. So it seems like the perfect time with that sort of nervous energy to jump into that first practice of mindfulness, which is sending out a little loving kindness. So with that energy, I'm also thinking about where your energy is today. Since we're not in the same room, we can't sort of share that experience. And I don't know where you are right now, and I don't know what happened just before you logged on. So in that sense, I would just want to have a moment of practicing loving kindness starting with some very simple words, which may be familiar to some of you, which is, may I be well, may I be safe, may I find peace, may you be well, may you be safe, may you find peace. May we all be well, may we all be safe, and may we all find peace. So with that as a start, then we would be thinking about, I'm going to stop sharing the PowerPoint presentation, mainly because with this being about attention and mindfulness, to some extent, I want us to have an opportunity to pay attention to whatever we want, not just necessarily my PowerPoint slides. So I'm going to try and shuffle back and forth. Whether that's a challenge that's worth it, we'll have to see. But just to sort of keep perhaps you grounded in your attention in other ways as well. So with that, in terms of my own experiences with mindfulness, I have been exposed to it since I was a young child. At age 12 was my first introduction to mindfulness. I have been able to attend silent retreats in convents near my home. I've gone to Taizé services where we're singing together in poetic verse. Also been part of an ecology team who had to look at 1 square inch of ground every day for a year. Talk about focused attention. So I've seen mindfulness in all aspects of life. And I was also luckily enough able to attend a course in my graduate school training on mindfulness. And so that's where I became more formally introduced to it. And then some of you may have experience with mindfulness, meditation, and some of the concepts, practices, and philosophies that we'll be talking about today. And all of that wisdom is welcome here. So I hope to be your conduit today for the voices of many talented and amazing teachers, because there are so many. And as I was preparing for this presentation, many more came forward that I had not known about. So it's a vast and fascinating and sometimes overwhelming area of study. So needing to get back again, focusing the attention, what are the essence of my wishes for you today? And that would be 3 things. The first is a broad stroke for mindfulness. It's as if I have with me a friend today that I want you to get to know. Mindfulness. I'd love for you to exchange email addresses and get to know each other a little bit better another time with a nice cup of tea and be able to dive into the depths of how you can connect with them. So this is just the very broad stroke of how mindfulness exists in the world. And I want you to take that and expand it how it works best for you in the future. The second is I want you to be able to sit, all of us, to be able to sit with the insights of 3 main resources. Nancy Bardaki, a midwife and the director of mindfulness-based childbirth and parenting. She has a lovely book. And I actually, now let me go back to sharing my screen. We'll see how this goes, where I can show you the PowerPoint of what that looks like. So there's her book, Mindful Birthing. We also, so she's a lovely resource. The second resource is a lovely book called Breathing Space for New Mothers by Allison Rogers and Erin White. And full disclosure, Allison is a good family friend and Erin is my sister. So this is a gorgeous book for the postpartum time to thinking about mindfulness. And I just love everything that they've created in this. So I wanted to share it with you. The third is a book called Trauma Sensitive Mindfulness by David Trelevian, who is an educator and trauma treatment professional. And I think he brings a lot of interesting perspectives on mindfulness for all of us to be just aware of. And so wanting to just sort of have a sense of what some of his perspective is. The third component is I want us to wander around the practice of mindfulness, to swim around in it, to walk around in it like you would a museum or in a forest where you're just sort of seeing what is around the next bend. So I'm hoping that we can do 2 and possibly 3 mindfulness exercises together today. So what is mindfulness? Mindfulness is rooted in a Buddhist meditation, and most often known in this country from the work of Jon Kabat-Zinn and his mindfulness-based stress reduction program through the University of Massachusetts. And what we were hoping to, this is the way that I knew him and mindfulness through that graduate program that I've had. And what a lot of the studies have shown us, based mainly in foundationally in the mindfulness stress reduction, was that mindfulness can help decrease anxiety, depression, irritability, and it can help us navigate more fulfilling relationships, decrease chronic stress, in which even including decreasing some of the physical components of that stress, including high blood pressure, chronic pain. And it's also now being used in a lot of recovery programs for drug and alcohol dependence. So, and now these resources for us are thinking about it in the perinatal period specifically. Perinatal being from conception to 1 year postpartum. So John Kabat-Zinn, he says what mindfulness is in one sentence, which I think is quite distilled and lovely. He says, mindfulness is paying attention in a particular way on purpose in the present moment, non-judgmentally. I'm going to say the sentence again because it is very dense. Mindfulness is paying attention in a particular way on purpose in the present moment, non-judgmentally. So in practice, this may unfold as our sensing the present moment rather than rehashing the past or imagining or trying to control the future. And is recognizing that in an emotional state, we have the choice to respond instead of react. And mindfulness is meant to be based as a tool in your toolbox. It's not meant to be a quick fix to get rid of stress of an unknown future. It's not meant to magically take the pain of contractions away or somehow stop the colic cycle of a 3-week-old. It is not easy being human. And mindfulness is simply giving us permission to be who we are in this moment. So I'm going to stop sharing again the screen if I can. Great. So now, as the wise Sarah King puts it so beautifully, mindfulness practice supports us in feeling into a pathway forward, which we don't have to feel trapped or hopeless in the face of uncertainty. It's a way that we may be able to find peace and even presence, even in the presence of turmoil. And there is so much uncertainty in our lives in the perinatal period. When will I go into labor? How long will the birth last? Will the baby sleep through the night? Am I doing enough? Am I enough? And nothing seems to be more the same, everything changing, nothing is stable. Your body is transforming very rapidly during childbirth. Your baby will practically transform in front of your eyes, it seems like, during those early days. And then the first year, immense change. Mindfulness helps us connect with the truth of transformational change. Feast on the joys and have courage for the sorrows. It is not a permanent condition. Nothing is. And with that truth, we're encouraged to turn our attention to the present. And that's not an easy thing to do always. So there's a great haiku poem that I love that reminds me of this practice. And it says, the first day of spring, I keep thinking about the end of autumn. And that resonates with me so much. That is often where my mindset is. Here we are in the moment, and I'm thinking about something else in the future. Here we are in the spring, where the leaves are beautiful and green and fresh, and the skies can be kind of bleak and rainy. And that's just where we are in the spring. So autumn will come in its own wonderful time with its joys and its sorrows, but mindfulness asks us and welcomes us to the spring. In terms of trauma, thinking about how mindfulness needs to be integrated into this larger sense of trauma-informed care that we are very mindful of right now in our healthcare. So mindfulness has many benefits. It also has its limitations, and it may not resonate with everyone. And I don't believe that mindfulness is that quick fix to all stressors. What is? And it's not always the right place or time for mindfulness, and sometimes you have to be with the right people. So studies tell us that the majority of us, some say up to 90% of us, will have been exposed to trauma one or more times in our lives. And the practice of mindfulness, sitting with fear, pain, discomfort, when it comes up, can exacerbate traumatic stresses, bringing up flashbacks, leading to feelings of shame, unsettledness, and even re-traumatization. So just as our loving kindness exercise expressed at the beginning, may we all be safe, I want to give us permission to move ourselves into a place of safety, emotionally and physically, if any of these practices are bringing up too much. So, wanting to go over some very basic information about mindfulness, sort of the foundational components first, and then we'll dive into the lens of perinatal time frame. We often say that we are our own best critic. So the first foundational sort of component is non-judgment. There's no such thing as good meditation. There's no such thing as bad mindfulness. There's no need to evaluate, fix, or figure it out. It's all about recognition. We enter into pregnancy, birth, postpartum, and parenting with a strong attachment of how we want something to be or how for something to turn out. And when it turns out differently, we have a lot of self-judgment that can take over. Feelings of failure, blame. My birth wasn't good enough. I'm a terrible parent. I have failed. Mindfulness reminds us we do not have to believe everything we may tell ourselves. We can be fully present in the moment of exactly how we are. Patience is the next foundational component, especially since we live in this place where we often have a sense of urgency, productivity, and mindfulness helps us learn that events unfolding at their own pace is not necessarily bad, or that a timetable that is not of our own choosing is not one that we can give ourselves over to. We're able to give ourselves over to it. In pregnancy, we see this when your due date passes and you're still pregnant. Or as midwives, we talk a lot about it as in terms of that waiting is not the same as doing nothing. And in the postpartum period, man, it takes a lot to get out of the house in the morning. You are on baby time, not your usual time. The next component is the beginner's mind. And the practice is not that you don't know, that means the beginner's mind is that you still acknowledge what you know. It's not that you don't know anything, but it provides a spaciousness for curiosity. That sense of seen one breath, seen them all. More a sense of each breath is unique and new to me. And you can ask any mother, no labor is the same, and each labor is different and than expected or hoped some. What is it like to be here in my labor? The space between what you know and the enormity of what cannot be known is that beginner's mind. Trust is another important component. Mindfulness can hold anything and everything. And it offers a different kind of trust where you're adjusting to yourself that you can handle whatever unfolds during the pregnancy and your birth with your baby, no matter how challenging, painful, scary, or far from what you imagined it to be. Another component is moving toward acceptance or non-attachment. Having attachment to an object, idea, or a way we want things to happen can sometimes pose our great challenge. We can't control everything, and we can't stop external circumstances from bringing us something that we don't necessarily like. Childbirth, it also brings up this preconceptions and expectations of how we're supposed to be behaving during these periods of time. So acceptance of the moment and of the situation and of yourself does not mean that you won't have preferences or that you will just passively accept everything that is offered to you. It is instead an acknowledgement that the situation is, and there is a starting point for change, and there is where you can be peaceful and confident in the choices that you're making. And this sort of last main component is something called non-striving. In mindfulness, there's nothing that to achieve, nothing to get, nowhere to go. When I graduate, you have this sense of sort of this mindset oftentimes of like, when I get somewhere, when I graduate, when I retire, when I get to 5 centimeters. And in mindfulness, we shift from the doing mode to the being mode. In the doing mode, the mind is thinking, telling stories, analyzing, judging, solving any problem that's going to come by us. And we need the doing mode to survive and function. And just like there's a complement to everything, night and day, left and right, chocolate and peanut butter, there is a being mode to balance that. And the being mode is cultivated into mindfulness when you are experiencing your thoughts, emotions, body sensations in that exact moment in time, just as they are. It is not dependent upon external conditions to dictate whether you will find yourself to be happy or have a sense of well-being. It is just being right here, right now. So this is all very heady stuff that we just talked about. And so how do we turn this into a practice? So Nancy Bardacchi, the author of that Mindful Birthing, talks about the breath, and she calls it a friend for life. And the breath is something that I think many of us are very aware of and very have had practice with in terms of increasing our awareness and focus. And some people use sounds, images, movement, but oftentimes there's at least one component of breath involved. It turns the ordinary, something we do, we can't stop, we just do it, into the extraordinary by just the fact that we're starting to pay attention to it. Take refuge in the breath. And so this is our first chance to do a practice. So then I'm going to start sharing my screen again. Fingers crossed. Okay. And I have this link, and let us know.
3-step breathing space.
To go ahead and follow this breathing space exercise.
This is a short practice called a 3-step breathing space. You could call it a practice in your pocket. It's a practice that you can do anywhere. It takes just 3 minutes, and there are 3 clear stages to the practice. Stage 1. Stop, pause, whatever you're doing, and make a change in your posture, perhaps coming to a more upright posture, perhaps standing if you've been sitting, perhaps moving if you've been standing. Simply bringing your awareness now to however you are right now, whatever you're noticing. In this moment, tuning into your internal weather. No need to change anything, simply noticing what is here now. Noticing the level of activity in your mind, or feelings that might be around. Sensations in the body. Spending some moments noticing, how am I right now in this moment? Stage 2, gathering your awareness and bringing your attention to the breath. Feeling the sensations of the breath in the body. Registering the changing sensations as you breathe. Stage 3. Now allowing your awareness to expand outwards around the breath to encompass the whole body once again. No need to change anything. Simply being how you are right now. Noticing body sensations, feelings, activity of the mind. Whatever's here now. And when you're ready, opening your eyes, expanding your awareness, and moving on to the next experience of your day.
All right, so that was a quick transition. Sorry for that quick transition. I should have prepared you more for it. But that is, in essence, a little, love it that she said it's a practice in your pocket, because it's a short, portable practice that you can take anywhere. And thinking about sort of your experiences of just that 3 minutes, and sort of a mindfulness thought about that is that you may have found her voice calming. You may have hated the silent parts. You may have loved the bell that she rang. And you may have gotten really bored with the breath. And all of those are fine to have and part of the practice. Because oftentimes we also talk a lot about the wandering mind in mindfulness. And that's where the mind seems to have a mind of its own. And that's very normal and accepted and expected with any sense of practice in mindfulness. The different ways that the mind can work, oftentimes people will say a couple different things that when they're in those practices, is that they'll see, for instance, something in their mind that's like a sky, and thoughts come in like clouds. And some thoughts are charged with energy and emotion, big storm clouds. Things like, I feel so out of control today. Other thoughts are super light and fluffy and wisps and zip by, like, I wonder what I should make for dinner. So both of them should be able to be acknowledged and then allowed to move at the pace that they like to come in and out of your mindfulness. Other people have told me that they see it as a flash on a screen that fades quickly or disintegrates slowly. And one friend of mine says that she feels like it's a ticker tape, or she's just in her mindfulness practice and thoughts just keep rolling by. And whatever or however, you can still go back to that sense of refuge in the breath. So the interesting thing to think about then, sometimes I get so excited to share all this information, I forget to take a moment and let some of this settle in. So shifting a little bit now to the practice in terms of childbirth and postpartum. All three of our resources that we spoke about earlier talk about the return to the nervous system. So Alison Rogers, she talks about that prerequisite from mindful attention is a soothed nervous system. And a soothed nervous system is a pathway to mindful attention. So it's very circular here. And you have to sort of find a way of entering into that positive feedback. So we have a lot of different parts of our nervous system. You have the somatic nervous system, and that's what you can have direct control over. I want to move my body, I can do that. The autonomic nervous system is one that we don't always have as much direct control over. And the autonomic nervous system is often that known as that fight or flight. or that rest and digest. And they respond to triggers like that we don't, or stimulus. So our heartbeat rises when we are startled, and that's part of the sympathetic or fight and flight nervous system. And the sympathetic nervous system is full of adrenaline. And that is not necessarily a bad thing. Again, we need this. We need to react to certain things. It saves our lives sometimes. It's that threat on the horizon, and we are ready for action. But it's not meant to always be our baseline state. And for childbirth, the complement to that fight or flight, that rest and digest, in childbirth, people often talk about it as being calm and connect. And I love that. I love that slight change in that lens of what to call it and then how to then understand it. So when we are safe, when we are in that calm and connect, or the parasympathetic nervous system, we perceive we are in charge, we are safe, and that's the part of the nervous system that's in charge. And so that's oftentimes in terms of oxytocin, that hormone of love that we have in birth and lovemaking and breastfeeding. All of those things are really part of the oxytocin parasympathetic nervous system. And so in labor, it's a cocktail of hormones, adrenaline and oxytocin. And when they're in, sometimes they can be in opposition to each other. So fear and stress can inhibit the labor process, and we need to feel safe in our births. And this starts with choices that we make on where you give birth and who enters into the room with you. And that mindfulness can help untangle the pain and fear of childbirth to help feel more safe and tap into a calm and connect. So Nancy Bardaki talks about that pain is an information from the body, that pain is information from the body to tell the mind to pay attention. So it doesn't mean that everything that hurts is harmful. And that is where she puts this idea of transformational pain. And she uses different words for contractions in labor, such as physical sensations, rushes, surges. Good old Ina May, our great guru of midwifery, talks a lot about surges or rushes for contractions. And that sort of shifts the angle again, that it's not necessarily that there is a separation of childbirth pain from pain of injury and illness, and helps us move from reaction to responding. So Nancy, I'm going to share our screen again because Nancy has this great visual about how she has a response to contractions with mindfulness. So here we go. I'm going to try and share my screen again. And so we see here the two different sort of philosophies she has about contractions. And so the top one is about a contraction pattern that is tapped into that fight or flight. So that sense of not feeling safe, feeling fearful. You can see that there's a lot of energy outward. So a contraction comes, you're experiencing that contraction, you're thinking about, oh my God, this is just like the last contraction I had, this is terrible. Then comes down, you're in this mode of suffering, reacting, and fear is how she's viewing it. And so there's a sense of you're not in the moment. You're thinking about the contraction that you just had or the contraction that's ahead of you. That adrenaline is surging through your body. And so then that is where it's harder to sustain energy for that cycle of contractions during this sort of tapping into the sympathetic. The bottom is the contraction pattern that she would like us to think about in terms of use with mindfulness. And this is cyclical energy that fosters more of a resiliency. So you can see there's a real focus on the breath. There's that rhythmic breath in and out. There's an experience of the contraction with the maximum pain. So you still experience the contraction. You still have that pain sensation, but your focus instead of the past or the future contraction is just on the breath. And then you come off of that contraction, you have this period of calm, ease, and peace of which you are fully aware. So then with that comes that sense of calm, ease, and the sensations that you're feeling. And then moving on to the next contraction. So that is how she is viewing that sense of being able to bring mindfulness to be able to experience contraction pain with greater ease. So I'm going to stop sharing my screen again. Okay. Oh, I'm so sorry. I see that there was not on the correct slide. Did I end up getting to the correct slide? I apologize if I did not. And I'll go back. Did it come up okay for you guys? I'm not seeing it. Oh, I'm sorry if we missed that. So I'll keep going, and then, oh, okay, I'll keep going. So then thinking about this mindfulness during contractions, she also wants to clarify that it doesn't always have to be used during a specific type of birth experience. So this can be used for all women and parents who are asked to, in childbirth, to be having to come in contact with moments of uncertainty and be looking for moments of ease, peace, and stillness to allow you to also be less fearful when asked to make certain decisions along the way. So it can be used for contractions. It can also be used for more of an emotional contraction or a tough, having a tough situation where there's a sense of uncertainty. So thinking about how she wants us to cope, Nancy talks about how we can help cope through the contraction with mindfulness. And there's, of course, the awareness of breath. And that's an interesting thought, is that when you breathe in, you are engaging that fight or flight, that sympathetic nervous system. And then when you breathe out, you are engaging the parasympathetic, or the calm and connect. So when you breathe out longer than you breathe in, then you're connecting with the parasympathetic nervous system and that calm and connect for longer periods of time. So I thought that was a great, again, little thing that can help you go into that feedback of mindful attention and a calmed nervous system. Many other things that she talks about is things that we do anyway: holding hands, placing a hand on the chest of either a partner or yourself, and feeling the pressure can help you feel very much tapping into that calm and connect. Interestingly enough, even just smiling, endorphins are released. And so there are a ton of parasympathetic receptors around the mouth. And so just smiling helps you tap in again to that calm and connect. It's harder to do with COVID. I miss that now because we're not seeing each other smile as much. But if you physically just bring yourself into that space. Sometimes people also feel like a mindful birth must be a really quiet birth, where there's just a lot of silence. And it's not, sometimes it is, but sometimes there's a lot of noise. And sometimes it can be rhythmic words that are used. I was lucky to attend a birth where one woman really felt like she needed to have the word yes repeated to her at the very peak of her contractions. She would start to say it, and then she asked us to say it for her. And by the end of transition, when things were really intense, we were calling out the word yes, yes, yes. And then a nurse popped her head in and said, "Is everything okay in here?" And we called back to her, "Yes, everything is fine," because it's just what she needed to be able to have that sense of calm for herself. So also counting, something that's very nice to do. I remember when I was climbing mountains, when I grew up in Colorado, we would have to when we were at high altitude, we'd have to take a breath for every step. And so we would do 1 step, 2 breath, 3 step, 4 breath. And when we were above tree line and trying to get up to that peak, it was very helpful. That's how we got up. And then Nancy also talks about a great thing called sounding that helps you feel very mindful, still aware of what's going on in that contraction, where it can be any sound that you need it to be. So I attended another birth of a good friend of mine, actually, where she was, during the contraction, deeply experiencing the contraction and letting us know in a very confident voice and some expletive language exactly how those contractions were feeling to her. And then she would come down off of that contraction and have a deep sense of ease. And one time when she would be, her partner was during these times of contractions, was feeling very worried. You could see in the face, worried, furrowed brow. And she opened her eyes and looked out and said, "Oh, what's wrong? Is something going on?" So she herself was not experiencing the worry and the suffering that her partner had thought that she was experiencing. Instead, she had the contraction. That contraction ended. She found a space of ease again. So it doesn't have to be a quiet space. You can experience that birth any way that you need to. So I was going to do a body scan at this point in time because that's the way that Nancy Bardacchi often says that's the way to return to the parasympathetic, to that mindful place in between contractions, where you are turning your attention to your body in that moment. I don't think we're going to have enough time to do that. So we'll wait. And if we have time at the end, we'll practice that body scan. But there are many wonderful body scans out there that you can be tapping into either through an app or through a script. One script that I saw, one practice that recommended that you record yourself doing a body scan. And then you listen to it so that it's this real sense of I'm hearing my own voice. And in times of stress, you're hearing your own voice tell you and walk you through the sense of mindful attention. So talk about an exercise in non-judgment. That would be for me. It would be hard to do that, but it would be interesting, I think. So let's go now to the sense of postpartum, what mindfulness looks like in postpartum. You've made it. You made it to the 4th trimester. Again, a whole other wonderful phrase, the 4th trimester. And the mindfulness foundations, there can still be there for you. So thinking about patience, babies have, shall we say, a very loose relationship with time. And so you're constantly being asked to do something without knowing when it will end. The feeding session, the colic, the teething, it is such an exercise in patience. The beginner's mind comes up again. We all become learners. We're learning what it means to be a parent to this child, or more than one child. What is your relationship with your partner, your friends, your family? New mothers experience profound relational change. There's room for acceptance, especially since, and that curiosity of allowing for whatever needs to be present can be present, because oftentimes we need room for both grief and ambivalence, along with the joys and excitement. Room for both desire to be with and apart from your baby. Frustrations, anger, self-doubt can be common companions in this time of parenthood. And you can work with this emotional contraction of the body that is triggered by your thoughts and your mind in the exact same way that you can learn the physical sensations of birthing contractions. So what you practice and gain in that mindfulness of birthing can be transformed into more of an emotional, quote unquote, contraction during the postpartum time. So you do the same thing. You breathe with it. You move with it. You become curious about it. You be kind to yourself about it. It will not last. We are seeing more and more research about pregnancy, postpartum, and how it changes your actual brain structure. And when they look at women in the perinatal period, researchers see changes in the brain that are responsible for caretaking and empathy and bonding, and that all makes sense to us. But it's also wrapped up in a hyper alert state of worry and anxiety. In a more ancient perspective, our fears would be focused on looking out for that tiger along the horizon. And in these modern times, we find that those fears of tigers harming our families are now in the shape of our own inadequacies that may cause harm to our families. Alison Rogers speaks about this in her book, and she calls this the deep and ferocious love that parents feel for their children and the incredible vulnerability that often comes up what often comes up for them when there is the truth that they cannot, without any certainty, know their children's future. So anxiety over what might happen keeps one from noticing and engaging what is actually happening right now. So again, we return to that same concept of our reflex from fight and flight to the potential of the response to return to calm and connect. Because parenting is such a fleeting moment. Oftentimes I've heard someone say too, parenting is where when you become an expert, you're out of a job by the time. So we don't want you to miss out, to be aware, to be able to be present in the things that are existing right now. So Allison puts together this wonderful exercise, another practice about something called grace. And it is another thing, practice in your pocket, where you can do it anywhere, when you're sitting, breastfeeding, walking, or waiting in line. And it is based on grace, meaning gather or grounding, gathering your energy that we put out to somebody else all the time, most of the day. We gather it back for the self. We rest, where it is a gift to the self. And sometimes it's hard to relax, but oftentimes it's easier to just rest. It doesn't have to be as active. You don't have to work as hard. The A of grace is ask, how am I feeling right now? And there's an open door policy for whatever comes up. Compassion, how would we treat ourselves if we were treating it as if we were a dear friend? If someone came to us with the same things that we're feeling, we would look at them with compassionate, generous eyes. So we can do the same for ourselves. And E is engage, ready to re-engage with life, the nervous system calmed. Allison said she thought of also using the word empowered. And I loved the thought of the energy of where that comes from. As you end the practice, you engage and empower. So let me see what our time is like. Okay, I think we have enough time to do this practice. And then we should be able to settle in. I don't know how, let me see if there are any big questions necessarily. We'll go ahead and try and do this last practice together. Okay, and I'll try to get to the right slide this time. Okay, so here is that sense of grace. Again, it'll be an audio where Allison's voice will come up and you can practice that. Take a moment to do this practice.
Welcome to Grace for New Mothers. Enjoy this guided meditation whenever you need to pause, breathe, and reconnect. Find a comfortable position, close your eyes as you listen, and your nervous system will do the rest. Let's begin. Gather your attention into this moment by feeling the rhythm of your breath. Breathing in and breathing out. Rest. Allow your jaw to loosen. Let your shoulders melt down and away from your ears. Release and soften your belly as you breathe in and breathe out. Rest in the sensations of your body and your breath. It's safe and good to rest. Ask, how am I feeling right now? Are there places of discomfort? Are there places of comfort, ease? Simply notice. Is anything changing as you breathe in and out? Compassion. Feel yourself touched by gentle compassion and understanding. We all struggle from time to time. We all make mistakes. Motherhood can be hard. We're all beginners. Breathe in to any discomfort. Breathe out compassion and tenderness. Breathe in to places of discomfort. Breathe out ease. Engage and begin again with your life. We can always begin again, one moment at a time, feeling a little calmer, more resilient. Come back to this nourishing practice often as you and your baby grow. Be well.
So just to sort of as a final thought with that practice and all the practices that we've talked about today, there's a sense that Allison said, let us greet the present moment as a friend, greeting it with generosity and love. And by greeting the present in this way, you are greeting yourself, not the self that you were or that you hope to be or wish to be or the thing you should be, but your present moment self. As mothers and parents, we need connection and we need compassion. And so here we are again at the end, or here we are at the end, and yet back at the beginning. Because when we started, we were talking about connection and how excited we were, how excited I was to be having that connection to you and to the sense of mind and body. And compassion, that start of that loving kindness and the loving kindness you have given me today with all of our technical difficulties as I navigate this. So it's very much that circle. And as a midwife, I love that circle. So of compassion and connectedness. And so I turn my attention back to the Huddle Up Moms hosts who foster both of these things of compassion and connection in our community. And may we turn our grateful attention to them and all of their amazing work in this present moment for us. Thank you so much for attending and for being with me today. And I hope that you find something that resonates with you here in terms of mindfulness, in terms of your own practice and your own loving kindness to yourself in this time for you. So let me know if there are any questions. I think that Kimberly said that there wasn't anything in the chat box, and there's no pressure for questions at all. I know that the Huddle Up Moms will be collecting our presentations to be able to make them available to you. And I'm happy to send these along just, again, as connections to those 3 wonderful resources that I have found. And there are so many more. So I hope you have a lovely time diving